In this video, I want to spend a little more time talking about what an issue addressed is. In the spirit of the Sentira system, this is a patient-driven exercise. This is not a patient coming in saying, I just need you to look at this little rash, and then you sit there going, no, we've got to talk about 10 other things. That's not right. This is about what does a patient need your help with, and they are the driver of that most times. Now, of course, maybe there's some crucial thing you just feel like you have to talk to them about, so that's between you and the patient. So there's the three levels are again based on the field work that I did to create the system. And so the website has some text that talks about this, but basically it's a time-based system in a sense. And so a brief assessment of an issue, which doesn't mean substandard because some issues don't need that much time, is up to 2 minutes of both the history taking and then negotiating the treatment plan. Moderate's 4 minutes, thorough 6. I think you'll find that if you have a patient with several chronic diseases, there's some efficiency that you gain by talking about their functionality and their quality of life in sort of global ways, that often it won't take quite that much time to cover these things thoroughly. So the way the page is organized is the 70 or so most common things we deal with are in the top section. Green means symptom, purple means diagnosis, yellow means infection, so we probably spend a lot of time here in the influenza, strep throat, bronchitis section. And then down here, there's a bar that then distinguishes the more common from the less common. So the same pattern is repeated of general signs and symptoms and then all of the different body parts. Other colors that aren't as commonly used, so this light blue is for cancers, the orange is for actually sort of trauma poisoning stuff, this slightly darker blue is for congenital situations, and then the purple is for diseases, diagnoses. All right, so the other thing I wanted to point out here that is different from what you're probably used to with ICD-10 or 9 is that this system actually has what are called fear codes. And, you know, this is something we deal with all the time. The patient, the real issue of why they came to see you is not even maybe a specific symptom. It's that they're afraid they have cancer, and that's really what you dealt with. And so there's fear of cancer, fear of other disease. Down here, you know, let's say somebody had a personal encounter that they regretted later, and they have, let me find it, they have fear of sexually transmitted disease. So these are some codes that I think better reflect the undifferentiated nature of what we do, and I just offer those to you to use in the appropriate situations.